Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we were talking about the proverbial fly flying around in here, ignoring, bothering us, but we need a fly swatter. Anyway, Marvin is back on the phone. Marvin. Oh, dial tone. Marvin. Marvin. Marvin's gone. Well, if you're out there, Marvin, you can call back, and our producer will put you back on the phone line, and we'll set that issue straight. So, what else? Interesting patients. You had any interesting things?
What have I seen? I mean, you know, what I treat is the sciatica. What I treat is the nerve pain down the arm, down the hand. You know, the levels in the cervical spine that, you know, where you see the dermatomes and the pain in certain areas. And because of the technology and the stuff that we have, no, I'm good.
Here, give me that thing. I'm gonna beat this fly to death.
There's so much that you can do without surgical intervention now with the leg pain and the arm pain.
And I think surgery is the last option.
Don't get me wrong. That surgery is the last option, and if we don't hit our marks within X amount of time, then we send you out to a good surgeon.
Yeah. And I think because of scar tissue is the reason that I hesitate on surgery, because some things work extremely well, but if you get some scar tissue set in and you're not rehabilitating it, there's a good chance that, you know, surgery, you know, could be worse than the disease itself. So anyway, Marvin did call back. Marvin?
Yes. Wait till that fly lands on his forehead and smack him with it.
Yeah, we're waiting for it to land.
I'd hate flies. Hey, I got one question for you, Dr. Reiner.
Yes.
Do you do penicillin?
Do I what now?
Do you have penicillin in your facility?
Penicillin injection?
Yes.
Oh, no, I haven't stocked that in the office in ages. I mean, you would do that in a county clinic for, you know, syphilis, gonorrhea, because it's, well, even gonorrhea they don't really use it for anymore, but there's some bacteria that are still do that. But the risk of penicillin allergies with giving penicillin G, which lasts forever, just far outweigh the benefit of giving it by mouth.
Well, I had chest congestion. I went in there and asked Renee about giving me a shot of penicillin. She gave me a substitute that caused me to have 4 hours of diarrhea, and I didn't really appreciate that. So I was wondering about penicillin, because back in the 60s I had the same kind of chest congestion, and a doctor gave me penicillin, and it took care of it.
Well, back then...
if you don't carry it, I won't ask any more about that.
Yeah.
I want to ask the other doctor about that rack, about stretching. I think I shrunk 2 inches over the years, because I had to shorten my pants legs 2 inches.
Marvin, you shared with us that you're 79?
Yes, I are.
I promise you, you've shrank at least 2 inches.
Well, at least 2 inches. That's what I say. I had to sew my pants legs up 2 inches.
Yeah. That's what happens, as Dr. Reiner was alluding to, when the pads between the joints start to decrease in height, we literally lose
Yeah.
height.
Yeah.
You know, and at the end of our lives, some of us are 4 and 5 inches shorter than we were in our 20s and 30s.
Yes, I found that out. Do you take Senior Dimension?
Do what now?
Senior Dimension.
Yeah, I take Senior Dimensions.
Well, Dr. Reiner does. I know that, but I'm talking about Christensen.
Well, we're working on that right now. Right now, the Senior Dimensions uses Kelly Hawkins for not Kelly Hawkins, but they use Affiliated for physical therapy, and they use Kimberly Farrell for chiropractic care.
Okay, I dropped AARP, but I went to Senior Dimension, and I have VA.
Yeah.
So I was wondering.
We're working on it.
Okay, so I'll have to check with what. Are you somewhere close to Dr. Reiner's office?
Well, actually, this is our office. The Wellness Center is Dr. Reiner's and my brainchild here in Pahrump, and we're across the street from the VA.
Yeah, we're right next to the VA. If you walked into the VA and looked left, you'd see the building we're in.
The chiropractor office?
Yes.
Yes, I went there. I told you, I explained that to you a couple of weeks ago, Dr. Reiner, that they were closed, and I was wondering if you did the work yourself, because I see your name on the door.
Yes, he does.
Yeah, I see patients there, and being the medical director, as well as authorizing people to continue their therapy. So that's what my role is, overseeing, you know, what we're doing in that office.
Well, what is it, Big Five? They sell this kind of a machine that you turn upside down and take the stress, your upper from your lower. Does that work out?
Well, that's called an inversion table, and I really push my patients over 40, 45 away from that table, simply because I worry about stroke, I worry about cardiac problems. When you're hanging 45 degrees, 60 degrees, it's very effective, but it's the same thing as the decompression tables that we use in the office. It separates the joints and it separates the disc in the back.
It's a much safer thing. It basically is a program thing where they hook you in, they strap you in, and actually the inversion tables require you to hang by your feet. This is actually strapping on your hip, and it's actually pulling in a different location. So I think it's much safer to be in that situation than it is to be hanging upside down, where you've got tilt situations. If you had a small aneurysm or something like that you might that would bleed, that could be an instantaneous cerebral bleed, which would be a mess. So I think you're right. I think it's a good idea. It's good for maybe younger people that can hang up and work on in the thing. But some of those I have an inversion table in my office, and actually when it does not allow you to go more than 13 degrees. Now these other ones that can hang upside down like a bat, I think that's very dangerous.
Well, a 79-year-old man, usually at that age, you have ankle symptoms.
Yes.
You have knee symptoms.
Yes.
You have hip symptoms, and if you can imagine the amount of force or pull on those joints there are by hanging from your ankle upside down. So I just discourage it. We use the decompression tables. They're more than effective, and you get the milking effect of pulling and releasing, pulling and releasing.
That's a very good point. That's a very good point, because it's computer driven, right?
Yeah. And that helps imbibe or fill up the disc with water. It brings blood supply. It brings nutrients in.
It's massaging the disc is really what it is. So yeah, without a doubt, that there's just no reason to get an inversion table if you got that. Some people love them, but I mean, if you want to do one at home, I think that's fine. You do it at your own risk, but the computer model is very much more effective and much healthier.
Much safer.
Yeah, much safer. Yeah.
Well, that's what I was thinking. It was about getting the weight off of my lower back. From your upper body weighs more than I guess the weight of it down on your spine. I was thinking about hanging myself in a matter of speaking, you know, like monkey bars.
I was about to say.
Just to hang your legs over it and hang down and get the weight off of it, because I find that if I sit on a couch, I can lean forward and rest my elbows on my knees, and I keep the weight off of my lower back. I feel a lot better. I don't have any pain this way.
Well,
Like I was saying about the shower.
Marvin,
that really helped me.
Marvin, you're separating the joints, and you are putting some type of traction on the disc. Again, I think you shared with us that you had an aneurysm problem a few years ago.
Aorta, yes.
Yeah, I would stay away from an inversion table.
Okay, I was thinking about getting one at Big Five, but I didn't want to put out $200.
Well, and it isn't a very good one at that rate for that kind of money. And they got a lot of problem with them giving out, and you could fall, you could do those types of things. So it would just be better off to let your insurance take care of it under the auspices of, you know, a physician, and you'll be much safer in that respect. Okay?
Well, your office is the one I usually go to see
Right,
Renee.
but what I'm trying to say is once we get that contract, even if we don't have it, other people do, and we can refer you there, okay?
Okay, I'll let you go then. I thank you for your time.
You're welcome.
I hope I didn't take up too much of it.
No, I mean, it's always good, Marvin. No question is too simple or too stupid or too whatever. You just thanks
Well, I
for
know a
calling.
lot of old people have back problems.
Exactly.
I've never had back problems until I started doing that roofing. And that some of that roofing, like I said, weighs about 125 pounds, and it's at
Well, you know,
down type material.
you know what, Marvin? Lifting weight, bending over, there's a 15-to-1 fulcrum. So if you bend over and lift up 15 pounds, then basically you got 175 plus pounds being placed, or 200 pounds being placed on the end of your back. So very important that lifting is done with your back straight and in good posture. But we're going to be having to cut off pretty soon, but you know, if you can get in, we certainly want to help you out. Okay.
Okay. Well, I appreciate that. Thank you again for
You're
your
welcome.
time.
You're welcome.
I hope I didn't inconvenience anybody.
Nope,
But
not at all. Thank you for calling in. We really
you're
appreciate
welcome.
it.
You take care of yourselves.
Yeah,
And
yeah,
I'll
there's-
see you sometime, Dr. Christensen.
Yes.
If I can get in there.
All right, please do.
We're working on it, and just remember that, you know, with what Marvin is talking about, I mean, there's so much information that you, the viewer, can pick up on that, because a lot of things are common complaints that people have over and over and over again. And we can really, as we're talking to one patient, there's information that other people will be able to glean off of. So.
Marvin's complaint is one of the primary complaints that I hear in my office from both female and
gotta go.
male.
So, hey, great show. Thank you for calling in, all you callers. I appreciate it. We'll see you here next week. Thank you.